I'm just sort of going out of the book because I have my reading and highlighting, so I'll just go over what I highlighted. And I have a few notes in here that, like last year, I was like, oh yeah, I remember them talking about that in the exam, you know. So, not that it's going to be that way this year, but we will search it out together. Okay. So phlebotomy, when you go to draw blood from the patient, okay, and this is just for you to look at, so you have something to stare at instead of me. Okay. When you go to draw blood from the patient, you have an order. Everything you do, you have some sort of order generated by the doctor. The nurse will pass it down, say, hey, go draw blood on Mr. Smith, right? And you draw these labs, and you go and do that. So it's an invasive procedure, meaning that you're sticking something inside somebody's body. Okay, that's what invasive means. So you want to make sure that when you put something in somebody's body, you want to make sure that you're doing a very good aseptic technique, so to decrease the amount of infection. You will need to know here, since we're looking at the pictures, and I think we've already talked about this, you need to know these veins for sure here, okay? Because it's going to ask you what vein what is your primary vein, and what's your secondary vein, right? And what's your last resort vein, and as you go through. So you need to know the veins because it'll use the name of the veins, all right? This median cephalic vein. Wait, wrong one. Cubital vein, media cubital vein. I think I'm having a little stroke. Anyway, it's that one in the center. Okay, that's your primary vein because it's big. It's a big vein. Okay, and it's easy to stick on most people. If you have an obese patient, then their veins are covered with fat, so they're not easy to stick. But a younger, healthier person, easy. You penetrate the vein, puncture the vein, do the venipuncture. Very good, easy vein to draw blood out of. This one here, where they're drawing blood out of here. Okay, and then not, you go to the side, which it's still a big vein. Okay, and if you look at the anatomy, it's the same vein. Like the cephalic vein is the same vein that runs down the distal part of the arm, right? So, it's a nice big vein all the way down. So just don't look in the AC. You can look distal as well. Okay. This, and we'll cover it, but since the picture's here, this is a wingtip infusion set. Any guesses on why it's called a wingtip?
Because it looks like it has wings.
Yeah, it looks like wings, right? So anyhow, it's a very small needle. You may know it as a butterfly. Okay. So it's a very small, it's like a 27 gauge needle most of the time. Somebody that has a normal pain tolerance, you could stick them with a 27 gauge needle, and it may seem like a little gnat landing on it. I mean, it's, unless you just jab it in there. You know, but if you just stop, do a normal venipuncture, then they probably don't even feel it. You would use a butterfly mainly on patients who have small, fragile veins, like geriatric patients, young people, even though they don't have fragile veins, they have small veins. Okay, so that might be, and then the tubing comes up here to this vacutainer cap, and then there's a needle that's inside here that you would insert the blood tube on there. Okay, and this is a vacuum system as well. Because I just wrote it down, so I'm just going to go ahead and say it. If your blood flow starts to sort of slow down in this process here, you may move the needle slightly. Just remember, you can't move it too far because you'll pull it out of the vein. Okay, so if you pull back too far, it don't come out of the vein, and then you're going to create a hematoma. You're going to lose that. But you can pull it back ever so slightly or move it up ever so slightly because the bevel may have attached to the side of the wall, the lumen, right? And so it may attach and slow the blood flow down. for a normal draw, you have this system here. You have the vacuum container with the needle on it, and they just puncture. They do the venipuncture with the needle, then insert the tube on the end of it, okay, to draw the blood out. So that's sort of that part there, and so the things that you need to know, sort of as you start out: complications, infection. Collect only the minimal amount. There's not a lot of blood. Even though you come up with the 5 tubes, you come up with a rainbow, which means you're collecting. This would be the rainbow that they're talking about. See the different color tubes? You collect one of each. That's why they call it a rainbow. Okay? Even though that sometimes you don't need all that blood, they go ahead and draw it. So let's say hypothetically you don't need that purple top for some reason, but they're going to go ahead and draw it. That way they don't have to re-stick the patient. They already have the blood. So anyhow, they try their best not to re-stick the patient when they look at that. But you draw that rainbow, but it's not very much blood at all. So the patient sort of freaks out because they don't realize how much blood they have in their body. We have 6 liters, right? And so a few ounces is not that much. It won't affect anything. So you understand this, that it's a little painful. Shouldn't be that painful, but it's a little painful, right? And so how to minimize the pain, and then keep the blood from clotting. And when you're done with that, keep the patient from developing that really nasty looking hematoma, right?
Okay, so whenever you draw blood and like the patient thinks like it's like so much you're taking out, what happens to that blood that you took out? It just automatically just replaces itself?
Yeah, just the same way that we reproduce blood. Blood cell, don't quote me on this, but your blood cells only live like a certain X amount of days. And I don't know what that is. That's Google. I can't remember. But, so the body regenerates blood cells. Yeah, they only live, because we'll get into this next 6 weeks for sure, but they can't regenerate because they don't, how do you say that word, mitochondria? Mitochondria, yeah, they don't have one of those. So they don't produce ATP, and so they die off fairly quick. All right. I can't help you if you don't know the anatomy by now. Veins, arteries, capillaries. Do keep in mind review the different layers of the blood. The vein. The outside layer would be the what? Tunica what? External. The middle layer. The inner layer. Good. So you remember those. Whoops. Don't want to do that. I just want to take that off. In review, just PPE, your gloves, right? You don't need a lot of stuff. When you draw blood, you need a set of gloves. If the patient's sick, like if you're going in there in your drawing lab and they're in for the flu or strep, you may want to put on a mask, right? But because you're in the spit zone, but you have to. That's just case by case. But minimum of gloves. Make sure you good hand hygiene and dispose the equipments properly. So when you're done with your needles and everything, you put them in a sharps container, correct? Mm-hmm. And then prevent infection. You have to identify the patient. We've already talked about this several times. In any procedure that you do, you go and you will make identifiers. The Joint Commission mandates this. The Joint Commission in review is that government agency that controls the inspection of the hospital. And so if you want a real simple answer, what Joint Commission does, they come in and they inspect the hospital, the supplies, the staff, the procedures, everything, and they make sure that it's up to standard. If it's not up to standard, the Joint Commission can actually shut the hospital down. Okay, so they have a lot of power. So when Joint Commission's in the hospital, that's when everybody's like really on their toes. And the administration is a little snappy because Big Brother's in there, right? Okay, so the identifiers are easy. You have the wristband. Every patient in the hospital will have a wristband. Okay, if you're doing this in a doctor's office, then you want to make, they won't have a wristband, right? So if you're going into room 1 in the doctor's office to draw a lab, you want to make sure that you're asking the name and date of birth and using the identifiers. It says in here the patient should be asked to spell their first and last name. That's probably going to be a policy thing. I've never seen anyone that, would you spell your last name? They do ask first and last name and date of birth. That's usually the identifiers that they use. Okay, they don't really get into the last 3, social security number or whatever. But they want it. If you're not in a hospital setting where they don't have a band on, then you want to make sure that you're just following your policies, right? Whatever but a minimum of two identifiers, I believe it is. The CLSA, we'll look at that in a minute. That's the government agency that sets down the procedures like the Joint Commission does for lab. Okay, yeah, it says at least 2. I need to underline that so I can see it. So at least 2 identifiers, and those usually 2 identifiers are name and date of birth. Okay, so you get your name and date of birth. If they're in the hospital setting, then a lot of times they will scan. They have things that'll print out the labels for the blood tubes, and they'll scan it, and it'll print out. Okay, so but you still, even if they have a name or a band on, a hospital band on, you still are required to say yes. Is your name John Smith? Don't do that. That's the wrong one. That's what not to do, right? So you say, what is your first and last name? Oh, John Smith. Okay, in your date of birth, and you're looking at your order, and you're comparing that to what the patient's telling you. Don't feed them the information like I was about to. Is your name John Smith? That's wrong. Bad. Okay. So, and obviously, if they're above the age of 18 and they're A&O times 4, then they would do the consent, right? You need consent. And in here, the informed consent is that you will inform them of what they're doing, but that informed consent is mostly going to be for more difficult procedures. So you would get an implied consent. Remember, implied consent is them just holding the arm out, okay? That would be implied consent. The other way that we use implied consent, if they're under the age of 18 and it's emergent, right, then we could use implied consent, or if they're unconscious. But remember that when they're holding their arm out, that's consent, if they are able to give consent, and they do have the right to refuse any treatment. Absolutely refuse treatment. They can refuse any sort of treatment. Okay? Make sure that now you've got the consent, you've got the form, you verified your test, and make sure you have all your equipment ready. Right? It's distracting for the patient, and it decreases the amount of trust that they have in you because you're about to stick them with the needle. Okay? So it decreases the amount of trust if you go, oh wait, I got to go back and get this. Oh wait, back and forth. Have everything together. Have your stuff together. Okay? Go in there, and then that way it builds confidence with the patient. Look for in your stuff, in your equipment, like your tray. Okay? If you're doing off a tray right here, this probably should be inspected the day that you're coming on shift, right? You should look over your equipment. But as you pull the tubes out, textbook-wise, you would look for expiration dates, cracks, something that's going to tell you that they're not going to hold the vacuum. Missing labels. If the label is not on there, then you just throw it in the sharps container, okay? The same way with your needles. If, you know, they come in a sealed package, which means that it's sterile, right? So they come in a sealed package and they're capped, but if the package is open, would you use that needle?
No.
Because we don't make assumptions, so if you're the first to use this tray and all of a sudden this package is open, you're going, oh, I wonder what that's about. So you would take that needle and just throw it in the sharps container. You wouldn't use it. And also check for expiration date. It is hard to have expired equipment in a hospital setting because they use so much of it, right? That stuff gets used up before, but textbook wise, you would go down through, look at the expiration dates, okay? The seals on it, make sure it's not been used. If it's been used, throw it away. Safety devices, make sure that if this is a safety device here, so they would, when it comes out of the package, you fold this back, okay? And so when you're done with the blood draw and you remove the needle, again, one-handed, so you have to have some dexterity. You pop the tourniquet and then you remove the needle and then you push the safety cap over the top in this particular one. Some of them are spring-loaded and they automatically withdraw back into the cylinder. Okay, but you want to make sure that the safety device, and then disregard the sharp. Before you stick the patient, make sure that the bevel doesn't have any little burrs on it or there's bent or looks abnormal, right? So that's pretty common sense, and we know we only use the needle once, right? So you wouldn't want anybody reusing a needle. Here, I stuck John Smith. I think this thing has to still be sharp. Let me go over here and stick bacon. You know, I mean, you know what I'm saying? And on the patient as well, one stick, one needle. It doesn't always happen that way, but it should. I mean, that's textbook wise. The needle does dull somewhat when you re-stick it back in the skin. Okay, but I mean, I live in a real world where I know that they're stick and they'll dig around a little bit. They can't find anything and they'll pull it out and try it again in another vein. That's not the correct way to do it. You should discard that. I mean, it does dull it some, but but really not enough to harm the patient. I've done the same thing before. Starting an IV, I'd stick, I dig around, I can't find anything. It's an emergent deal. I don't have time to really open another one on the same patient, right? You know, I'm digging around and I'll just like pull it out, and if it's bleeding, have someone hold blood or hold pressure over there, and I'll come over here to the next arm and start digging again a little bit, or maybe come over to a different vein. Since my tourniquet's already on, I'll have my partner hold pressure, and I'll come over here to this other vein, and I'll try to cannulate that vein. Okay, do the venipuncture over there. But sometimes that amount of time that you're taking to open another package is life or death. But the correct procedure, okay, is to discard the thing, right? But it just doesn't happen that often. Okay, so the tubes, make sure that they're within expiration dates. The additives on the tubes, if the tubes expire, the additives, that's what's important about that, is the additives may not work. It may not prevent whatever the additives don't do. If it prevents clots or if it does something else, it may not work because of the it's expired. But that's rare. Again, labels, if the labels are off, don't use it. Especially if it's expired or something that it may not do the test correctly. And then these are the adapters we're talking about here. The little hub that goes over the top. This is the little adapter here that stick the different colored tubes in to vacuum system to pull the blood out. So look, make sure that they're there. Tourniquets, yeah, it's supposed to be single use, but that doesn't always happen. So if you're in the hospital and you see somebody reuse a tourniquet, it's like, Don't worry about it. Don't go to the charge nurse and say, Tech just reused a tourniquet. Oh, okay. You know, anyhow, sure, they're supposed to be single use, but a lot of times they get reused. I mean, they're just going over the skin. But if they have blood or dirt or something on them, boom, throw them away, right? And most of the time they do. And they don't. And if they have blood on them, they need to go in a red bag. If they don't, then just throw them in regular waste basket, regular trash can. Alcohol pads, same way. Tear them open, single packet. Don't reuse the alcohol pad, so they're cheap. So if you have to go back and re-swab, get a new alcohol pad, re-swab it. Okay. Aseptic. If they dry out, they lose their antiseptic properties. It's alcohol, so it's basically for cleaning the skin. Okay, but do use them one time. So just things that probably be test type questions. Okay. Even though I've used where's my alcohol pad? And I'll pick it up and reuse it again because it's still wet. Let the alcohol dry by air. Before you do the venipuncture, wipe away let it dry, and then by air is the best way. Okay. If you get alcohol mixed in with the venipuncture, it may affect the test. It goes into labeling, right? So we label everything. Fortunately, in your book, they hand wrote this label. That may be in a doctor's office where you would handwrite a label, but in the hospital setting, all these are going to be printed off the computer. So all the information is going to be on this label already. Okay. If you have to hand label one, then fill out all the blanks, right? And then you would initial it or sign it with the date and the time of the specimen, whatever it is that you have. If you noticed in lab, they scan that wristband and it prints out the label. So if not, then they print them off the computer. They don't know what to do if the computers go down. I don't know if you've ever been in the hospital yet when the computers went down, but they freak out because they don't know how to do paper charting anymore. They're like, we have to write this down. Yeah. Well, we used to always write it down. Okay. Good. Anything there with those basic procedures? I know we went over it pretty quick, but that should be all reviewed, right? Same way with these dermal punctures. On the finger sticks, they need a smaller amount of blood. They may have those capillary collection tubes where they put it up there and they're just drawing a small amount. Ever how you say that word? What's that? Yeah. There you go. That decrease, we talked about that, it's decrease of red blood cells in hemoglobin. Okay, so definitely make sure that you know your vocabulary. Very important. Okay. But these dermal sticks are common. Glucose, cholesterol, test. Maybe they just need a small amount of blood for it. They pick them up in the capillary pipettes. From chemistry, you know what a pipette is, right? The little thing you squeeze. Okay. They may put a drop of blood on a chem strip, like in a glucose test or something. Down here it says, now this is important here because they add in a number, right? So infants younger than 1, a dermal puncture is preferable because it requires less blood. That is important on infants, not to take a lot of blood. They're small, they don't have as much, right? So, but that would be a very good test question if I was writing a test, which I'm not, but well, you know, what age do you do? Why? Or what age, right? So do keep that in mind. Some adults, a lot of adults have these, what they're considering compromised veins. I use their terminology, okay? But medication sometimes trashes these veins. They make them hard, or they make them really fragile when you stick them. And I was reading through here, and there's actually a word, I'll have to come across it, but when you blow a vein, you know, that you just touch them with a needle and the vein blows. You just won't hold a needle or a catheter or anything. Right? So they're real fragile veins. So maybe that's when you would use this butterfly to try to, you know, do that. Well, if you can't get that, then you do the dermal stick. Remember, you can do arterial, capillary, or venous, right? Dermal puncture specimen contains 3 types. So arterial, capillary, or venous. You don't want, depending on what your test is, you may not want arterial blood, right? But you do hit a artery. I had my cholesterol checked one time just for grins, but they stuck me in the finger, you know, to do that like a balloon, you know, quick, and they hit an arterial, and it was really cool. I went outside and I played with it for a little bit because every time it was, my heart would beat, it would squirt like a long way. Like, that is so cool. And then put some pressure on it, stop it, you know. But finger stick wise, okay. I mean, if you do mix the blood, different compositions of blood, just tell the staff. You know, the phlebotomy is part of the laboratory staff, but the person that runs the test is called a medical lab technician, and that's a 4-year degree plus. Okay, so those guys that spin the blood and test the blood, they have degrees. Phlebotomy is like a weekend course. So these guys have a degree in that. So make sure that you inform them if you have different blood than what you originally started out for. This is review as well. You know, adults, children younger than 1, you know, you could do the 3rd or 4th finger. So again, these are all things that you should highlight because these are all things that might show up on the test. You know, you have a 1-year-old you're about to do a finger stick on, which finger would you use? That type of question, okay? They say go off to the side of the finger because the tip of the finger is more sensitive. I don't know about that. You know, I mean, I would think the side of the finger would be really like, oh, I've never had anybody stick me in the side of the finger before, nor will I let them stick me in the side of the finger, right? But especially some, you know, that like. But that just seems odd to me. But anyway, let's go with what the book says. Okay, so it's more sensitive. So do it on the side. There's a picture in there showing you where to stick and where not to do the dermal puncture. And they do, most of the time they come in the auto injector little things where you just press it on there and it injects it in. But when it says never perform, that's again a scenario based. So you go up to a patient that is cyanotic or something, they have peripheral cyanosis, and so you wouldn't perform this dermal stick, finger stick in a cyanotic hand or over a scar or a rash, something like that. So again, those are important to keep in mind. Good?
Yes.
Okay. Review. I know. Work down through the review. There's no way that you're going to memorize this, okay? But do read this several times, like on the different procedures where you're familiar with it. Okay, so if you have a question that involves the procedure, you're familiar with the way that you do this. You know, check the warmth of the hands. Hold down the hand below the level of the heart for 30 seconds. to me, those are always good test question type things, okay? When it has a time or an age in there, make sure that wash their hands, okay? And then this would increase blood flow as well. Warmth increases blood flow. I know because I sit on a heating pad almost every day before I go to the gym. I get up there and I sit on my heating pad a little bit to get the blood flowing in my lower back. Okay, so it does work. Here, 70% isopropyl alcohol on the pad or the wash. Again, good test question. You know, if you look at your hand gels, they're like 62 or 63%. All right, back not too long ago, there was a virus that came out, and this little virus that came out really promoted hand gel like crazy. I mean, what's the hand gel? What's the most popular one? What's the name of it? Germax or something. I mean, if I'd have only known some little bug was going to come out and revolutionize hand gel, I would have bought stock in Germax. I mean, but because before that, and I forget what bug it was, everybody was freaking out over it, but it actually just turned out to be a bit cold. It wasn't anything. I mean, they shut down schools and they did all this silly stuff. And I say silly stuff because they didn't read the research. Everything only lives so much outside the host or outside the body. So I mean, they shut down schools and did all the cleaning and all this other stuff with it. And all they had to do was just wait for the weekend. Because it only lived like 24 hours outside the host. So if they just make it to the weekend, they just shut the school down, and then whatever bug is on the desk is dead. It's dead. But man, I'm telling you, hand gel just, everybody was, give me that hand gel. Like, okay, whatever. There's still a lot of research on hand gel. I mean, you look at it, some researchers say it doesn't work at all, really. I mean, you have to, and we've talked about this before, you have to leave it wet on your hands for a dwelling time. You have to leave it wet for so long on your hands. Everything has a dwelling time. But not to chase that rabbit. But when it first came out, hand gel was like 50%. And then it went up to 62, 63, and everybody's going, oh yeah, we got to have more. Now it's 70%. Okay? Some say you just should take 100% and sort of wash your hands off with it. But anyway, so the percentage is going up. But it's just to remove those little microorganisms, move them away from the area that you're going to do the venipuncture in. Okay? Whether it kills them or not, that's a whole different topic that I really don't want to talk about. Because you have to have so many, the setting has to be right to kill certain microorganisms, but anyway. It says do not use the iodine, right? So I would highlight that. Do not use the iodine. Let it dry prior to the puncture, and do not use the iodine. It should have some adverse effects on these tests, the bilirubin, the uric acid, phosphorus, potassium. So, sample type question is, you go into John Smith's room and you're about to do a uric acid test. Which cleaning solution do you use? And they have iodine there, and they have isopropyl alcohol, right, at 70%. They might have some at 50%, to try to trip you up. So those are good type questions to sort of remember, right? And then you're about to make the stick, so you lower it down, let gravity do the work, and use the auto lancet. Wipe away, when you're doing the finger stick, wipe away the first drop of blood with the 4x4, okay? So it gets the alcohol off there, it doesn't affect the test, and then use the second drop of blood. And then it says in here, don't scoop it, right? Because all of these will affect the accuracy of the test. Then, again, good test question, don't take longer than 2 minutes to fill each tube, because the blood will clot, okay? You're sort of in a time area here, at certain tests, you don't want the blood to clot or hemolyze, right? Y'all know what remember hemolyze? What does that mean? Hemo, blood, lysis, Lysis. Yeah, cut, break up. So if those red blood cells may break apart, become destroyed. So then you put a little 4x4 on there or something and tape it up, hold some pressure, or a Band-Aid. Heel sticks, sort of the same procedure, right? Except here, this was a question. So you know, for infants younger than 12 months, it gives you the medial or lateral side of the plantar surface of the heel. So the plantar surface is the one that steps down on if they could walk, right? And so don't use the back of the heel. There's not a lot of blood flow in the back. It's thicker, so you use the sides. It still seems more painful to me to use the sides, but anyhow, they didn't ask when they started doing this. So it gives you a picture. Would it say no and a yes? Would it be the heel stick? And it's essentially the same way, except you want to use something warm, a heel warmer or something on the heel to get a little bit more blood flow. Then make sure you hold the little kid's leg down, because when you stick them, they're going to move, right? Then they'll cry, because you hurt them. Read down through the procedures. It's pretty much the same as a finger stick, okay? Except the 3 to 5 minutes for the healing, warm towel or healing device, okay? Make sure it doesn't go deeper than 2 millimeters. See, all those are good things to remember for the test. Thankfully, it's multiple choice. So you study for a multiple choice test differently. And so you just some of these things, because it's too much information to know everything, right? On any certification exam, you're going to miss questions, okay? So you just want to be familiar with a lot, because you can't memorize all that. Venipuncture is sort of the same way, okay? It's the same process. You want to have everything ready, position the patient, make sure that you do have to do a little assessment on them, like if they're sitting up. Have you ever had any problems with venipunctures before? Because you break out that needle and bam, right? Or you stick them and they see blood and their own blood, and they. So you want to make sure that you ask them if they ever had problems with it before. Give them a little rest and to improve the position of the veins. You hyper, see that would be flex, extend their arm. It pushes those veins up to the surface a little bit more. Don't put them in an arm lock, but hyper extend their arm a little bit. Selecting a vein, we just talked about this. As you go distal on the arm, you have to be a lot more careful because the nerves and arteries become real superficial. So if you're down here or on the dorsal hand, there's not much tissue there, okay? Most people don't have fatty hands, so there's not much tissue there. So those arteries, arterioles, are superficial, and those the nerves are as well. Okay, so you have to know if you know where you hit a nerve with a needle. The patient's going to go ouch at some level. Right? If you do hit a nerve, that's where that expression, "You're on my last nerve," you hit a nerve, right? You hit a nerve, withdraw the needle. Stop doing what you're doing. If the patient tells you, "Hey, this really hurts," stop doing that, right? So that's almost common sense, correct? Someone's telling you, "Hey, stop that! That really hurts." Then you probably want to stop, unless it was your intent to hurt the patient. I don't know. maybe that would be, not saying anything, maybe the 5th. But do look, it gives you a list of first, second, third choices of veins, okay, to use. If you go dorsal, on the dorsal hand to draw blood, you'd use your wingtip, your butterfly usually, okay? And just remember this is more superficial, so the angle, that 15 to 30 degrees, you want to go really flat on the hand. Then it mentions the considerations we would not do the venipuncture, mastectomy. Remember, patients have breast cancer. They're gonna, if they're conscious, they're gonna tell you, hey, you can't do needle sticks on this side. You should already know that. Another thing that's not on here, but if they have a shunt, if they're a renal patient, we'll talk about this when we review medical